The health and medical information provided during this webinar, as well as the questions and responses from the webinar providers, are solely for informational purposes. This content is not intended to take the place of advice or treatment from health professionals. Nothing presented in the webinar is intended to be used for medical evaluation, diagnosis, or treatment. It is not intended to substitute for your relationships with your own healthcare and pharmaceutical providers. Always seek the advice of your healthcare provider before beginning any new treatment, or if you have questions regarding a medical condition.
We're going to move into the question and answer session.
We've categorized them by the various parts of my talk, and I'm going to jump into the general category, which somebody asked the question, what do I recommend for the treatment for a diagnosis of so-called venous leak? Well, really quick, hearkening back to the slide that I showed you, that how erection occurs, which is that blood rushes in and it traps blood there by putting compression. And so the term venous leak alludes to this idea that no matter how much pressure you put in the system, blood is continuing to leak out. And what I want to say to whoever asked this question, or if it affects you, is that in the modern era, experts like me rarely really believe in the term venous leak. Venous leak, I find, is often a diagnosis given by individuals with less expertise, and really goes back to the 80s and 90s before we really had such a deep understanding of physiology. Because what we now know is that what we used to call venous leak is really just a lack of arterial pressure, a lack of hydraulic pressure. Because if your pressure doesn't get high enough, blood's going to continue to leak out. So how do we treat venous leak? The same way I just described to you. We augment the pressure going in with the medications I just described to you. And when it's not enough, or when it's not restoring an erection to your liking, then it's time to really have a serious discussion about penile prosthesis surgery. For this discussion, you need to see an expert, somebody like me or in your neck of the woods, and you may need a blood flow study called a penile duplex Doppler. Is there an alternative to injections and pills that's safe and low cost? Well, the good news I have for this question is that in the modern era today in the US, pills and injections are low cost, and therefore there really isn't a need for alternatives. And as I indicated earlier, there really aren't alternatives to these things. These things don't take the place of being healthy. So this doesn't take the place of taking care of your diabetes, taking your heart medications, treating your hypertension, exercising regularly, and eating a balanced diet. So nothing can replace that, and each and every one of you should be doing those things. But when you're not getting erections that are hard enough or lasting long enough for you, you shouldn't shy away from these treatments. They're affordable and they are cost effective today. How do you correct a bent penis? Well, I think what this question is alluding to is a disorder called Peyronie's disease. Again, those cylinders, those very elastic cylinders that I described to you. Well, Peyronie's disease is a disorder when men lose elasticity in a part of that system, in a part of or all of that system. And it can lead to a crooked penis, because if you lose elasticity in one portion of the cylinders, but you're still having elasticity in another part, the penis bends toward the area where the elasticity is lost. It's like holding a slinky and pinching a part of your slinky. This requires a discussion with an expert. In the modern era, we have medications that we will often try with medications you put in your mouth. We have injectable medications that can help break up that scar tissue, which is leading to the loss of elasticity. And then for some men, we still need to consider surgery to straighten the penis. And sometimes that surgery also requires us to restore the erections. And for that, far and away, the gold standard treatment is the penile prosthesis. Can platelet-rich plasma, or PRP, injections successfully treat any causes of ED? Unfortunately, the answer to that question is no. There have been many committees, some of which I have served on a national level, that have investigated all the evidence and randomized controlled trials looking at PRP and erection restoration. And unfortunately, this data always falls short. This will not prevent some healthcare providers from selling PRP to you. And I would simply discourage each and every one of you from contemplating this PRP or the so-called P-shot to restore your erections. It generally is putting money and resources into something that has been proven not to be effective. And I would much rather see you take your time and money towards an effective treatment like the things I discussed with you today. What's the next step if pills, shots, and a vacuum pump don't help? Well, you should absolutely give strong consideration to a penile implant as the gold standard for restoring your erections. Are there any gels or topical applications that aid in ED? This is a really good question. Well, you may recall that gel that we showed in one of our slides, and there are some compounding pharmacies that will take a similar medication that you can apply topically to the skin of the penis. Now, full disclosure, most studies have suggested that this is not really effective. It just doesn't absorb fast enough or work well enough. It doesn't mean you can't try it, but yes, there are topicals. They're probably just not really effective. Okay. Could genetics play a role in ED performance? 100% yes. Remember how I said some men succumb to ED as early as their 20s, while other guys who are like daily smokers are having great sex till their 90s? Well, this is genetics at work. We have different genetics in each of us that is changing our fate to some degree. It's why I have the build I have, why my blood vessels work the way they do, and probably why I'm going to begin developing erectile dysfunction at a certain age. Unfortunately, you can't change your genetics. So what you can change is your environment. And that's why I say take your healthcare issues head on, address diabetes, address heart disease, take charge of your diet, and most importantly, take charge of your exercise plan. Find something that you do habitually, and my objective for each and every one of my patients is to try to achieve 150 minutes of cardiovascular exercise per week. Find something that you take joy in, something that you'll do repeatedly each and every day. Okay. Let's move on to some questions that relate to men who have had treatment of prostate cancer by having their prostate removed. One question that somebody had, is there any hope for ED and orgasm treatment after radical prostatectomy? 100% yes. Now, not all men have impacts on their orgasm after having their prostate removed, but I want to provide some words of clarification here. Getting an erection is the act of actually having your penis get hard. Orgasm is that climax, that sensation, that feel. And then in some men, an orgasm leads to an ejaculation. So there are three separate components here, and they are not entirely linked. A man can achieve an orgasm and ejaculate without an erection. And some men who can get an erection can't achieve a climax. So these things aren't related. But as it does relate to prostatectomy, yes, there are many treatments to restore your erections, including each and every one of the treatments I mentioned today. Yes, there are some potential treatments if you're failing to achieve an orgasm. But when it comes to the ejaculation itself, unfortunately, no. That is one thing that cannot be restored, because the organ that makes the largest contribution to that fluid that comes out of your penis when you orgasm, that is removed when you have a prostatectomy. I'd like to know when to start doing injections if the pills don't work. It's been 4 months since my prostate surgery. Well, this is a scenario where I would strongly recommend that you return to your urologist about initiating therapy. If you're really not getting any response to the pills that are prescribed to you at all, I'd say the time is now. You're a great candidate to consider various forms of rehabilitation. Injections is just one of them. You could consider injections, and you could consider having a vacuum device. Talk to your doctor who removed your prostate about what their expectations and experience are. And if they're not ready to talk to you about it, ask them for a referral to a specialist like me. After prostate cancer radiation treatment, will I be able to get an erection or climax again? Yes, absolutely. But will every man get back to their baseline, and will everything be the same? It might not be. But once again, radiation treatment for prostate cancer, without a doubt, does injure the mechanism for getting an erection, and for some, it can injure how you orgasm and ejaculate. But there is a recovery process. It's also true that radiation generally is slower. It may not harm your erections right away, but the effect of radiation can be more prolonged over time. So stay in touch with your doctor, get a referral to a specialist, somebody like me who can walk you through all the steps. We have lots more questions, and I really wish I could answer them all tonight, but unfortunately we've run out of time. I chose a sample of questions that I felt would really speak to hopefully most men who are present, and hopefully this will inspire most of you to get out there to seek some restorative treatment and realize that intimacy, like you remember it, can be had once again.
Thank you very much, Dr. Walsh, for taking the time to answer those questions. If you'd like to learn more about ED treatments, you do have a few options. There will be more resources in the Resource Center on menmd.com. You may visit this page to view instructional videos, guides, expert articles, and more. If you're interested in learning any more about the implants, we highly suggest that you head over to edcure.org. Over there, you will find everything you need to know, everything that was covered on this event, and more. If your question was not answered and you'd still like to follow up with someone at MenMD and hear from a clinical support case manager, you can call MenMD at 857-233-5837 or log into the secure MenMD portal and can schedule an appointment with a MenMD personal health assistant to better assist you in your treatments. If you'd like to compare any of the treatment options that we covered tonight on tonight's event, you can do this on menmd.com. You can navigate to the ED condition page and you can scroll down to the treatment section where you can select up to 3 treatments to compare.
If you found this video helpful and want to stay in the loop with our growing men's health community, be sure to subscribe to our channel and click the bell to be notified when new content is available. Your support makes it easier for other men like you to find these helpful resources. Thanks again for watching. We hope to see you again.